Kia ora. My name is Dr. Mazda Turel, and I am a neurosurgeon affiliated with the Wockhardt group of hospitals in Bombay Central. A neurosurgeon is somebody who treats conditions of the brain and spine, both medically and surgically. I did my medical training at the Grant Medical College and then went on to pursue a 6-year course in neurosurgery at the Christian Medical College in Vellore, following which I stayed there as assistant professor for 3 years. After that, I went to the Toronto Western Hospital to do a fellowship in minimally invasive skull-based surgery and neuro-oncology for 1 whole year. Following that, I went to Chicago at the prestigious Rush University, where I did a fellowship in minimally invasive spine surgery. After that, I did further studies in Shanghai in China, where we did a cerebrovascular fellowship. And after completing these fellowships over a 3-year period, I returned back to India, in which I've started practice at the Wockhardt group of hospitals with whom I've been associated for the last 10 years. Minimally invasive surgery has revolutionized the outcomes of surgery in all branches of surgery, with a special emphasis in neurosurgery, which includes brain and spine surgery. Minimally invasive surgery in the brain, we are able to access certain tumors through the nose, through the ear, and even through the eye now. What this does is that brings about minimal tissue disruption, but yet allows us complete access to the actual pathology in the brain to be able to deal with this. With this, there's less scarring, less infection, quick mobility, and exceedingly quick return to work. Now, patients with brain tumors can get back to work as soon as 1 week from the time of an operation. And as you know, the spine is an extension of the brain. Neurosurgeons are extremely well versed and skilled at treating all spinal conditions effectively. Minimally invasive approaches, wherein which we make an incision that's just about 1 or 2 centimeters big. We never cut anything apart from the skin. The muscle is just retracted with a series of specialized tubes, and we go to the exact point of action and decompress the nerve and cause relief of pain. The advantage of minimally invasive surgery is that there's very less tissue damage. The pain is excessively less. The patients are able to mobilize within 1 or 2 hours of surgery. There's almost no chance of an infection, and the recovery is excellent, smooth, and fast. The healing also takes place very well, and patients are very, very happy and satisfied with the outcomes of minimally invasive surgery, which is what we tend to focus on. And about 80 to 90% of cases in our setup can be done in a minimally invasive fashion. With the advancement of technology, with the advancement of tools that are available, with the intraoperative X-ray machine, the intraoperative navigation, we also have the intraoperative robot now that helps us use technology in aiding these patients with spinal pathologies. We are able to treat several pathologies such as cervical discs, lumbar and cervical stenosis, certain tumors in the spine, and infections of the spine with minimally invasive techniques, which result in excellent outcomes in the correct patient, chosen in the correct fashion to be operated at the correct level by the correct surgeon. It gives me great pleasure to note that we have treated several thousands of patients from across various continents of the world with minimally invasive brain and spine surgery, and I'm happy to tell you that we've had excellent outcomes with great patient satisfaction. We focus on integrating technology and holistic care to be able to give back to our patients the quality of life that they need. So in case you know anybody who is suffering from any of these brain or spine conditions, we would be happy to help them with care and dignity. Thank you.